Hello, everyone. Thank you so much for joining us. We're going to wait another minute or two to allow a few more people to hop on, and we'll be starting shortly. Thank you. Hello, everyone, and welcome to our virtual health series with UCHealth. My name is Hannah Parrott, and I'm the Senior Event Coordinator with the Highlands Ranch Community Association. We are so excited that you took the time out of your evening to join us tonight to discuss vitamins from A to Z. We are grateful for UCHealth Highlands Ranch Hospital as the community partner and happy to host this event with their assistance. Before we get started, I have a few housekeeping items. We are recording the webinar this evening, and we will be sending that out to you via email by the end of the week. During the webinar, your microphones will be muted. To ask questions, please type them into the Q&A chat box. This can be found in your control panel on your screen. We'll save the questions for the Q&A portion towards the end of the event. Our presenter this evening is Dr. Phillips. Dr. Phillips is a family medicine physician from UCHealth. And now, without further ado, I'll pass the time off to Dr. Phillips.
Hi, everybody. Like she said, I'm Dr. Phillips, Dr. Christine Phillips. I'm a family medicine physician. Right now, I'm working for the UCHealth Clinic in Lone Tree, Colorado. I was born and raised in Georgia. Go Dogs. I did my medical school, the Medical College of Georgia, and then my residency training up in Queens, New York, at Jamaica Hospital Medical Center. And then most important thing about me is my two pups and my husband, but the pups are much cuter. And I am, that is kind of a little bit about me, just because I think you should know who's talking to you. So to get started on vitamins are one of those topics where there is a biochemical definition and then more of a colloquial definition. So the biochemical definition is a lot more narrow than what we usually use, even physicians use in day-to-day life. When we say vitamins, what we really mean are there's 13 essential vitamins. These are what we call micronutrients. These are things that we have to have in our diet. They are all organic materials. I won't bore you with too much biochemistry, although a little bit to talk about it, but it is stuff that we do not make on our own. So because we don't make these on our own, we have to get them from our diet. However, they are not macronutrients, which would be protein, carbohydrates, and fat, because we need those at much higher quantities. These are much lower quantities that we require. And then each of them have their own established daily recommended intake. Those standards are set both by, each country has their own kind of established guidelines, and the fact that they're different tells you that there's still some controversy in exactly how much we need of them. So there is, nutrition science is one of those things that is still very much being researched and still very much parts of it are not well understood. The first vitamin was actually discovered in about 1910. So we're talking 110 years of even knowing these things exist. So it's still very much a newer area compared to other areas of science. And one of the reasons why we know about vitamins is because of their deficiency diseases. So each vitamin has a very much more apparent deficiency disease. It is something that's not common. None of these are commonly seen in the United States anymore. They're pretty unusual, with some exceptions. We'll go over those. And then some of them are dangerous at high levels as well. So you can take too much of some of these vitamins. Some of these vitamins you really can't take too much of. They might not make you, they might not help you, but they're not going to hurt you. So some general principles for vitamins that we have found over the years. It's better observed with foods and supplements. So while some people are going to be recommended to take some of these vitamins to make sure we're getting enough, it is always more advisable to eat a well-balanced, diverse diet, so we can better absorb them. That is how our bodies are made, and that is how our bodies can handle these a little bit better. For daily supplements, for every person, there is no general recommendation, especially not in the United States, that says everybody should take a daily multivitamin. And there are some specific situations where it might be beneficial. And then we'll go over, the guidelines of the United States Preventative Task Force. This really is our body of recommendation. I'll go over what the recommendation is and what it means. But also in general for vitamins as well as dietary supplements, and we'll go over the difference between the two in a minute. A general principle is most of them aren't going to hurt you, but it may not help. It may just make your, may be really expensive and make your urine a funny color, and that's about it. The two exceptions that, again, we'll go over in more details, vitamin A and vitamin E, and I'll talk about kind of where those might get you into trouble and why we recommend against not necessarily supplementing those, but being very careful about not taking too much. All right. So to name or to kind of define what we're talking about more. So dietary supplements is a legal definition. And that legal definition was set by an act by the Dietary Supplement Health and Education Act of 1994. So that is the body that kind of said, this is what these are, and this is how we're going to regulate them. And so those dietary supplements are vitamins, minerals, amino acids, botanicals, and live microbials. So that's going to be your probiotics. So the reason why I mention this is because when you go into the vitamin section of your local grocery store and it's overwhelming and there's a million bottles, what you're seeing there is vitamins, but you're also seeing minerals, you're seeing a mix of all of these. They would really be classified as dietary supplements, and that is how they are regulated. And why I talk about the regulation to kind of, get in the weeds a little bit, and this is just copied and pasted from the FDA website. The reason why it's important is because it also, the way that these are regulated is different than medication. So things that that have gone through the FDA approval process in dietary supplements are different, and that has pretty big impacts on their effectiveness and their safety. So one of the things that the FDA does not do is they do not approve dietary supplements for safety or effectiveness. So before they're sold to the public. So what they can do is once they're in the public, if they are safety issues and if there are or they're making claims that can't be proven, then they can regulate that afterwards. But it's not a process where they need to do it beforehand. So that means that there can be stuff on the shelf that is not safe and is not effective. So that's one thing that makes it pretty challenging. And the other thing is, since it's not regulated as a food or a drug, you can also have proprietary mixes in there. So sometimes the labels don't have specific. Sometimes it has natural additives and stuff like that that we don't know about. So those are a little bit harder to give you advice on whether they're safe or not in general. But I know for me, for most family medicine physicians, for most primary care doctors as well, always welcome to bring in the bottle and say, is this safe to take? What do you think about this? Give me your opinion. Those opinions might vary. There is a lot of different opinions out there about supplements. It's a fairly controversial, like I said, it's very much an area that is still actively being researched. So therefore it is something that there's a lot of opinions. There's a lot of I've seen a lot of doctors disagree very strongly on what to take and what not to take. So I know that makes it hard. And unfortunately, I don't have all of those answers, but always willing to talk through it. I like to go through the pros and cons of everything that people take and really make it a shared decision about what to take and what not to take. Okay, let's see. And then I'm gonna, I just wanted to throw this slide up quickly at the beginning. I'm actually gonna go over it in more detail later, but this is just kind of those tips and tricks of how to be safe and how to spot fraud, basically, because unfortunately this is an area where fraud is going to be very common, especially the dietary supplements. Not so much with the vitamins, although some of the vitamin claims are not totally proven, but definitely with more of the dietary supplements, more of the botanicals and things like that. All right, so to get into the weeds a little bit about vitamins. So when we look at vitamins, there's kind of two different types of vitamins. There's the water-soluble vitamins and the fat-soluble vitamins. The reason why this is important and why I bring this up is that water-soluble vitamins in general, they dissolve in water. It is excreted out through the urine, and it's pretty easily gotten rid of, which means that in general, the water-soluble vitamins it's hard to take too much of. Now, it's also the ones that make your urine change colors, especially the B vitamins. That's when you'll notice you have expensive urine now, but they are not stored in the body except for folate and vitamin B12. So they're excreted pretty easily. Now the fat soluble vitamins, so when you see those in the store, they should come in something that looks sort of like this, or that color. They're usually stored in oil. And so that's A, D, E, and K. And you'll notice I mentioned briefly earlier that two of the vitamins that might have some safety things are A and E. Those are fat soluble vitamins. The reason why it's easier to take too much of these is we actually store these in the liver and on our fatty tissues. So we can get too much of these occasionally. All right, so when we say B vitamins, there's a lot of them. So you might be asking yourself, why is there no vitamin F? Why is there a vitamin B3 and not a vitamin B4? Well, in general, vitamins were named semi in the order in which they were found. And the B vitamins are all kind of grouped together because they all help biochemically in the building of and the metabolism of carbohydrates. And so they all do similar but distinct things. The reason why there's no vitamin B4 is they found out that what originally was vitamin B4 is not a vitamin. And by that, I mean, it's not something that is essential to the diet. It's not something that the body can't make itself. Because the body can actually make up the majority of what we need with those building blocks, those proteins, fatty acids and carbohydrates and the minerals. So to kind of go through the B vitamins, so this is thiamine, it's also vitamin B1. So like I said, a lot of these will be similar metabolism of carbohydrates, proteins, and fats. This thiamine B1 is particularly important for nerve and heart function. I put in through all of this the recommended daily intake. This is for adults. Children have a little bit of a different intake, and the elderly also will have a little bit different intake. And then there are some exceptions as well. And then men and women tend to have different requirements as well. And we'll be going through all of this really quickly. I'm trying not to get bogged down and spend more time with questions and more time on some of the other things. But I did just want to throw this up there where we get it from. And you'll notice too that liver is a really good place to get a lot of your vitamins. So our primary source is going to be meat such as pork, liver, and then eggs. And then for plant sources, it's grains, brown rice, and potatoes. In general, all of the vitamins can be found in both animal sources and plant sources. There are some exceptions, which we'll talk about. And so the deficiency symptoms of these is beriberi and Wernicke-Korsakoff syndrome. So one of the things, like I said, the deficiencies are really severe deficiencies, not mild deficiencies, that we can sometimes see in the United States. And so this is fairly rare. However, ingestion of alcohol makes it difficult to utilize thiamine, and it kind of gets rid of all of our thiamine. So we will see Wernicke-Korsakoff syndrome in patients who are very heavy alcohol drinkers. So sometimes you might see thiamine being supplemented in people who have alcohol use problems. In general, though, it is one of those that is not gonna hurt you. So the taking too much, some people reported drowsiness or some muscle relaxation, muscle weakness, but it's pretty rare. And in general, like I said, with the B vitamins, we're going to get, our body's going to be able to handle too much of it pretty well. And we're not going to have an overdose syndrome very commonly. So something that isn't very often deficient of, but also not going to hurt you. All right, so riboflavin. So this is vitamin B2. So again, metabolism of carbohydrates and proteins. One of the biggest things, and I tried to put pictures on everything of kind of one thing to remember. So this, I have the grains, this one I have the tongue. And the reason is because it helps with the mucous membrane. So the tongue, the mouth, the anus, and those kind of things can have swelling or have dysfunction when we don't have enough riboflavin. So we have riboflavin in dairy products, and then also in vegetables and in fruit like banana, greens, beans, asparagus. And my sources are not comprehensive. So it's just an example. There's a lot of riboflavin is in a lot of things. You'll also see riboflavin being added to a lot of foods or being fortified. If you see the word fortified, what that means is that vitamins were added into it. So you'll see that really commonly in cereals and things like that. The riboflavin is one of those that's added. It's pretty unusual to have someone be deficient in this, and there is no disease of having too much riboflavin. So, excuse me, niacin is our next one. So niacin, also metabolism of carbohydrates. One of the things that you can have with riboflavin, if you take riboflavin of niacin, you take too much of it, it can cause some liver damage, especially if you take really high doses that could cause flushing. Niacin is one of those things that we actually sometimes prescribe still, usually for high cholesterol in patients who cannot take statins. So that is something that, and there's a lot of kind of over-the-counter uses for niacin as well. So you might see this one recommended. This is one to definitely let your doctor know if you're taking it. And definitely, if you take too high of doses, you will have side effects from it. Most of those are not long-term side effects, like vitamin A and E. All right. This one I cannot pronounce, vitamin B5, I believe. So not something that is, sometimes it's in a B complex vitamin, but that's not something that's supplemented super often. And it's something that is pretty unusual to have a deficiency of. I've never seen it. And sometimes if you take too high of doses, you'll have diarrhea. But in general, not one that has gotten a lot of news or a lot of hype around it. Pyridoxine, pyridoxine vitamin B6. This one is interesting. So it is also involved in metabolism of carbohydrates, amino acids, and fats. Again, just like all the B vitamins related to metabolism. This one also has it helps. It's essential for the formation of red blood cells and healthy skin and nerves. So one of the things that you will notice with deficiency of B6, again, pretty unusual to have a B6 deficiency, but possible. It can cause some anemia, not as commonly as some of the other ones like both folate and B12, which we'll talk about. It can also cause peripheral neuropathy. So what that phrase means, and I apologize if I'm using too many technical terms, always ask me what I mean if I don't explain it. It's hard to talk about vitamins sometimes without getting into these doctor terms. So peripheral neuropathy is basically just nerve pain in the fingers and the toes, kind of those far from our brain, as far from your brain as you can go, is peripheral. And so kind of numbness, tingling feeling in our hands and our feet. So if that's something that you're experiencing, it might be worthwhile to try some B6 in a reasonable dosage and see if that helps. If it's taken too much, it can cause some nerve damage, but that taking too much is pretty hard to do. So if you're taking it as it is indicated on the bottle, then you should be just fine. The special kind of considerations to the special uses for B6 is some people find it a benefit to them if they have carpal tunnel syndrome. This is not something I always remember, but I know some people have had have had some good results from it. And again, it might be worth using. One of the main uses that I tell patients is morning sickness. So not just associated with pregnancy, using B6, and then also using sometimes Unisom and those in conjunction as kind of my first step for morning sickness in pregnant women. All right, next one is biotin. This one you'll hear a lot about, and it is in a lot of formulations that help with the hair and the nails. And I have seen people do pretty well on it. It is, again, associated with carbohydrates and fatty acids. It really can help with the skin. Deficiency, you're going to have dermatitis, which again is a fancy word for itchy skin. So if you have too low of this, it can make you itch. Not going to be a problem with taking too much. One of the interesting things with biotin is that one of the places it's found is in raw egg yolk, but there is a protein in raw egg whites that impairs the ability of the body to absorb biotin. So if you eat just a plain raw egg, which I do not recommend for a lot of reasons, one of the reasons is that you will not get any of the biotin from that meal. So if you like your eggs over easy, that might be a good idea. Cook all the egg white and then have that runny yolk. The other thing with biotin that I always like to mention, because it's not always thought about, is it actually can interfere with the test that we do for thyroid stimulating hormone, or TSH. When you have thyroid problems, you can have, that's the hormone that we check. That is a signal from the brain to the thyroid to release hormone, to release thyroid hormone. And it doesn't actually impact the thyroid's functioning whatsoever. It's just the assay that's used in the lab. It can make the TSH look higher than it actually is. So it doesn't affect the thyroid in the body, just in the laboratory. So basically, if you have a lower functioning thyroid, let your doctor know if you're taking a supplement of biotin in it. All right, so folic acid. This one is really important and something that is commonly encouraged to supplement. This is one of the few that is like definitely has uses in taking a supplement for. So this folic acid is really important in the formation of red blood cells, DNA, RNA, and nervous system development of the fetus, which is one of the most important things. So having too low of this, so in adults that aren't pregnant, the biggest thing is anemia. Basically, megaloblastic anemia is your red blood cells get really large. And folic acid or folate, which is just a similar, it's the same thing that's just a little bit altered. Most of these have more than one name. And this is megaloblastic anemia is also seen in vitamin B12 deficiency as well. So folate and B12 are commonly checked as well for patients who have anemia where their red blood cells are really wide. We'll go over kind of which ones we check, which ones we don't in the future. So for people who have megaloblastic anemia, we'll definitely do a folic acid supplementation. And then also in women who are trying to conceive or are pregnant, we do recommend taking a prenatal vitamin. And one of the things the prenatal vitamin has is increased folic acid. And the reason is because the neural tube defects, what that means is that the brain and the spinal cord don't develop properly, and it's catastrophic. It's really terrible. So to prevent that from happening, we recommend everybody take as much folic acid as in a prenatal vitamin. And there is no overdosing on folic acid, at least that we know of. All right, so to talk about megaloblastic anemia again, so this is vitamin B12. This one is definitely one of those that is very commonly supplemented, very commonly talked about, and very commonly checked. So it is extremely important for red blood cell maturity, nerve function, and then creation of DNA. It is one of the only vitamins that doesn't have a plant source. So it's only made in animal proteins like meat, fish, eggs. That's supposed to be milk. That's the primary source. Luckily, it is an easier time to be vegan now because they actually can. They have a lot of supplements now that are from bacteria or archaea synthesis. So there are non-animal protein, but there are no plant protein or plant sources, not protein, plant sources. So the main deficiency syndrome is the megaloblastic anemia. However, at low dose, when your level is a little bit low, you can also have symptoms like fatigue, a little bit of cognitive decline. You just don't feel as well. And there's no taking too much consequences from that. None have been proven. One of the special things about vitamin B12, there is actually a autoimmune disorder called pernicious anemia. What that is it is actually the immune system attacking the cells that absorb vitamin B12 in the GI tract. And so our body can't get it from the diet, and it can't get it from supplements, oral supplements, which is one of the reasons why this is one of the deficiencies that we see most often, because sometimes this happens. And the workaround for that is injection. So either IV vitamin B12 or much more commonly injection into the muscle B12 injections. So you'll see that it is covered by insurance when it's for a medical reason, when you have pernicious anemia, megaloblastic anemia. This is also one of those things where you can go to a med spa and usually get a vitamin B12 injection. It's not going to be dangerous, and it might help some fatigue, some cognitive concerns. is it going to, it's certainly not a guarantee that it's going to make you feel more energetic or better. And sometimes it can be quite expensive because it's not going to be covered by insurance for those cases. And actually, without signs of anemia, some insurance companies won't even let me test the level. So we don't always check it, but it is probably one of the most commonly checked vitamins. All right, finally, out of the B vitamins, onto vitamin C, another one that gets a lot of news. And the reason why is because the use of vitamin C, I mean, it helps with bone, skin, connective tissue, scar formation, helps the body absorb iron, but it's also involved in the immune system. And that is the biggest draw that you'll see. Take vitamin C when you get sick, take vitamin C when you get sick, which may not be helpful. It is not something that there's a lot of mixed data. And what I mean by that is there are a lot of studies that show it can help, and there's a lot of studies that show it doesn't. So there's not great guidelines. It's one of those things where it doesn't really, sometimes vitamin C is given in very high doses for treating things like Lyme disease or some other protocols, especially in integrative medicine practices. And so it certainly doesn't seem like it's harmful. It might have some stomach pain, diarrhea, gas side effects, but as far as long-term side effects, not so much. But there's a lot of hype around vitamin C as well. And you know, once if you are deficient in it, it will absolutely help your immune system. But if you already have a good level, taking more when you have a cold hasn't really been borne out by the research, hasn't really been shown to help. But again, this is one of the controversial vitamins, and it's certainly something to think about taking. This is also the vitamin that causes scurvy. The deficiency causes scurvy, you know, the classic pirate with his teeth falling out and all of that lovely stuff, and bleeding, because actually, if you run out of vitamin C, your scars will open back up. So it's really not a good deficiency. And this is one of those that it's hard to get from animal sources. So this is mostly in fruits and vegetables. There are some sources in liver. So if you are, you know, there are some people who are doing kind of an all meat diet. It's not something I would recommend. But if you do, make sure you're getting organ meats, because organ meats are going to be your only source of vitamin C. Much better to just do fruits and vegetables, but you definitely don't want to give yourself scurvy. All right, so to switch from the water-soluble vitamins, now we're going to the fat-soluble vitamins. So this will have much more of this one we have to be more careful with. So vitamin A. So vitamin A, a lot of people think of the eyes. It's actually night vision that it more helps with, because it's for those light sensitive cells. So those really light sensitive cells, so the nighttime vision that this really helps with. Daytime vision, it's not used as much for, but it is very important for healthy skin, healthy eyes, the linings of the lungs, the intestines, the urinary tract. So the main source of vitamin A, there's a lot, you'll see a lot of different names. One of the ones that's getting more popular right now is beta carotene. And beta carotene is orange. And so this is found in things that are yellow or orange, especially the fruits. And that's because those vitamin A derivatives like beta carotene are actually pigmented that color. So think of your yellow and orange fruits when you're trying to get more vitamin A. So if you don't have enough vitamin A, the biggest deficiency syndrome is going to be night blindness. If you take too much, they have shown evidence of increased bone turnover. So what that means is that when our bones are constantly being formed and then broken down. That's just a process that continues happening. Our bones are very much a living tissue, and they're changing all the time. And so that just happens more rapidly. And when that happens, the bone that they lay down isn't as good. And then it can also lead to problems with calcium and other problems as well. So weak bones and problems with calcium is a problem with taking too much vitamin A. And then also, it can also impair absorbing other fat soluble vitamins. So if you take too much vitamin A, especially at the same time, you could become deficient in D, E, or K. The reason why this one, so the beta carotene formation that you'll see over the counter is the one probably I would recommend taking. It's much less likely to cause those problems if it's something that you want to take for your eyes or other things. But again, you're probably getting enough of vitamin A. The reason why vitamin A, the USPTF, United States Preventative Task Force, felt strongly enough to recommend against vitamin A supplementation was because of this reason, was because there is a definitive connection between the risk of lung cancer and smokers. So if you are a smoker, do not take vitamin A. It will increase your chance of lung cancer. And that was enough that says, let's just avoid it, because that exact link is not super well understood at this time. But this one is one of the two, the vitamin A and vitamin E, that you should be careful with, more careful than other ones. This one is too small, so sorry about that. I fixed it and then must have sent the one before I increased the font. So let me pull up my screen so I can actually see the font. Okay, so vitamin D, this is another one that is very, very important, very in vogue. This one is very important and is very unique in that we actually don't primarily get it from our diet. This is the one vitamin that we don't eat so much of. We get it mostly from sunlight. And as you can imagine, we get a lot less sunlight now, living indoors, wearing clothes, than we did when all of our systems were developed, were created. So the vitamin D deficiency is or insufficiency is really common, and I'll go over kind of that controversy in a second. So vitamin D is really important in the balance of calcium and phosphorus. It assists in the absorption, but it also plays a really key role in the bone formation, bone growth, and bone repair. And if you have too much vitamin D or you have too little vitamin D, you can actually have calcium either leach in the bones or spread out to other parts of the body, which is really dangerous. So vitamin D is really tied closely to calcium. So that's why you might hear take calcium and vitamin D, especially as people age, especially women. And we'll talk about why that is a little bit, and have a little bit on some minerals as well at the end. So I added minerals as well as vitamins just because that's also really common. So like I said, we get most of it from the sun, but that risk has to be balanced with the risk for skin cancer. It's actually the UV lights themselves that convert vitamin D, that convert the precursor to vitamin D into active vitamin D. So that UVB is also what causes skin cancer. So that risk has to be balanced. And unfortunately, things like sunscreen make that block that UVB light. So then we don't create vitamin D from that. So there are some sources online, and I'm all about risk reduction. So if that is something that you're interested in, there are sources online on how best to get vitamin D from the sun instead of a supplement, instead of a medication to take. But that skin cancer risk is still there. So this is one of the other ones that's commonly recommended to actually supplement. Let's see, and there are some sources, mostly things that are supplemented and things that have omega-3 fatty acids like fish. Sometimes we'll have vitamin D, and some mushrooms have vitamin D. The deficiency syndrome in vitamin D is rickets or osteomalacia. If you've ever seen children with really bowed legs, that's what rickets is. The reason that happens is because the calcium is leached from the bones. It makes the bones soft, and the bones are actually bowing out. So that's true vitamin D like deficiency. Too high of vitamin D can lead to higher concentrations of calcium. That calcium deposits in bones and soft tissues, the heart and the kidneys, which is not good for us. So we want to be careful about taking too much vitamin D. This is one of the vitamins that we do fairly regularly check. So there is quite a bit of controversy on what is the normal blood level of vitamin D. So for a long time, it was 20 international units per deciliter, which is the typical range for vitamin D, or the typical units for vitamin D. So for a long time, it was 20. And then they were looking at it and they increased it probably about 20, 30 years ago to 30. So now anything under 30 is considered insufficient. However, that's most people. This is one of those that most people are below 30 unless they're taking a supplement or they spend a lot of time outside without sunscreen on, which I would not recommend. So that is, some people think that the range is incorrect and we're just fine in that 20 to 30 range. And some people feel very strongly about not checking vitamin D at all. I still fairly regularly check it. And what I'm looking for is not so much, are you in that 20 to 30 range? I'm looking more, are you in a 5 or 6 range, single digits, very low. If you're very low, you might be prescribed a supplement for vitamin D. And that would be 50,000 units per week. And the reason why I think that's so important, one, vitamin D deficiency can also cause us to feel fatigued and just kind of not feel super well. So whenever someone's coming in for fatigue, this is one of the things I check pretty regularly, but also for prevention of fractures. So because vitamin D has such a big role with calcium in bone health, if someone is deficient in vitamin D, it just really increases the risk of fracture, especially in osteoporosis. Women are much more likely to have osteoporosis after they've gone through menopause. Estrogen is actually protective for the bones. And once we lose estrogen in that menopausal state, that's one of the things that can happen is our bones kind of weaken. They lose calcium, they lose some of their strength. So I do recommend supplementing vitamin D in postmenopausal women pretty universally, unless you're high, which I've never seen someone naturally high before. Most people I check, almost everyone's low. All right, that's vitamin D. Vitamin E. So this is another one. So this functions as an antioxidant in the body. This is one that is not from meat sources. It's fruits, veggies, nuts, and seeds. The deficiency syndrome is pretty rare and not very well understood. We know it's necessary, but it is pretty easy to get your recommended daily intake. If you take too much of it, it increases your risk for congestive heart failure. And one of the things that researchers do sometimes are mortality studies. So what mortality studies are is they actually say, okay, for looking at a very large population that takes vitamin E and looking at a similar population where they don't take vitamin E, what is their life expectancy? Vitamin E actually has a life expectancy. Patients who take high levels of vitamin E have a lower life expectancy. So this is one of those that has a mortality cost to it. And we're not exactly sure why. That's still being kind of delineated out, but it's probably safer to not take supplements. It is in a lot of daily multivitamins, and that level that you'll see in daily multivitamins is not enough to cause those increase in mortality. But if you're taking a dedicated vitamin E supplement, it's something to think about and talk to your doctor about. All right, looking at time, we're gonna speed through some of this stuff. It's a lot. Vitamins are a lot. It's a whole couple of months of medical school. Whole books are written about this. So just real quick with vitamin K. So this has to do with blood clotting primarily is what I think about with vitamin K, and then bone health. It is, if you don't have enough vitamin K, your blood doesn't clot. This is extremely rare, except for in patients who are premature. So when you have babies, they're frequently given injections of vitamin K at birth, and the reason is they're more likely to be deficient, and they can have pretty severe bleeding. This one has a special kind of thing to think about. If you're taking the drug warfarin, which is a blood thinner, you need to avoid vitamin K at all costs, and you need to be careful with the foods that also have vitamin K, high levels of vitamin K in them. It will lead to warfarin not being as effective, and it could lead to blood clots. It's actually, when you have bleeding on warfarin, what we give you in the hospital to reverse warfarin is vitamin K. So warfarin works on vitamin K and the clotting factors. So I'm going to speed through the minerals real quick. So I just wanted to touch the minerals because I know people have a lot of questions about them frequently. They're not vitamins because they are technically their own elements. So it's not a building block that's not considered one of the 13 essential vitamins, but it is also something that's really commonly in supplements. And so for things like calcium, gonna be in a lot of supplements, especially for women's taking it and making sure that you have enough vitamin D and calcium is so important for bone health that most supplements geared around women, especially older women, are going to have both in them. When I list these kind of different delineations, macro, micro, trace, that's the amount that we need. And I looked at quite a few different sources for this, and they all kind of have different ones, some of them only have major and trace, but basically we need more calcium and magnesium. We need a little less of copper, zinc, and iron. And we need very, very little amounts of selenium, boron, and chromium and iodine. So calcium we talked about. Magnesium I check fairly regularly. It's really important for nerve conduction. The most important nerve conduction that can have an impact on that magnesium can have an impact is your heart's conduction. So your heart is powered by nerves and electrolytes. So magnesium is frequently checked with that. Iron makes blood cells, carries oxygen. This is commonly checked as well, and it's common in supplements, especially in pregnant women, just because they need more blood. Iodine is important for the thyroid. Oh, we're going to skip zinc. So real quick, this is the US PTF recommendation. So that's the United States Preventative Task Force. So this is our body that tells us when you need your colonoscopy, when you need your mammogram. It makes big recommendations for the whole population of the United States. So this is where it's recommended against the use of beta carotene and vitamin E, so vitamin A or vitamin E, and for the prevention of cardiovascular disease or cancer. There might be some other reasons why you want to take it, but definitely not for those reasons by themselves, because of those dangers that we talked about. And then the I, the grade I for all of the other vitamins is insufficient. So basically they can't make a delineation either way. They can't tell you it helps, they can't tell you it hurts. All right, so this is just a quick representation of what you'll see on a supplement label. So it's going to have a serving size. That's going to be really important. I would follow the serving size recommendations unless your doctor has told you otherwise, because that's going to help keep you out of trouble of taking too much and getting some of those symptoms of taking too much. And then it's going to have the international units, or the milligrams I use, all of those kind of in this thing here. And then what I think is more helpful is the daily value, which is the percentage of what you need. So in this, it has 300% of your vitamin C, so way above, and that's because we don't absorb it as well. Some of these don't have percentages. That's because there's no agreed upon daily value. And the other thing you'll see is there's a lot of different formations. So there's actually 5 different formations for vitamin E. We may find at one time that it's actually one of these specific types that's dangerous, and the other ones are safe, but don't have great evidence on that. And same thing with vitamin A. There tends to be more, and there tends to be more than one formulation, and that's a whole other discussion about what is the best one to take. Those are hard questions to answer because the research just isn't quite there yet. But there are some guidance out there, so it's always a question that you can ask your doctor, and they can look it up. So common recommendations, like I said, in general, these are going to be not going to hurt, may not help. It might just be really expensive and not going to do much for dietary supplements, especially. The exception to that is vitamin A and E, which has some long-term health consequences. The ones that I most commonly check are vitamin D, B12, and folic acid. I really don't check other vitamins. And some of them don't even have assays where I can even order the lab and send off. It's just so rare to have a deficiency that the cost is not worth the cost of actually doing the lab. We check calcium, magnesium, and iron pretty often as far as minerals. And then common recommendations for specific people are calcium and vitamin D supplements for osteopenia or osteoporosis, or those patients with low bone density. Folic acid for those wanting to become pregnant or are pregnant. Iron supplements for women who are menstruating or pregnant if they have low iron levels. And vitamin D supplement, as I recommend it for most people. And then I think the biggest thing here is be wary of hype. If it sounds too good to be true, it probably is. Unfortunately, we're very complex beings, and everyone's metabolism is different. So if someone's telling you that this thing is going to cure all of your problems, it's probably not. And a general rule that I really like is cure all, cure nothing. So if it's telling you it does everything for you, I would be worried of that. And always make sure to take a look at the label. If you have any questions, take it to your primary care doctor. I think that's a really important piece. And so sorry for going over, but ready for questions. Resources.
Yes, thank you so much, Dr. Phillips. We will go ahead and take some questions now. So just a reminder, please type your questions into the Q&A chat box. This can be found in your control panel. And we do already have a few questions. The first question I have for you, Dr. Phillips, is, taking magnesium 360 milligram, I'm wondering what else I can take to avoid hand cramps from overuse. If I need to take calcium and vitamin D, what do you suggest? Also, what is the best multivitamin for women over 50? So loaded question for you.
Yeah, great question. And so for the magnesium, if you're taking that level of magnesium and it is not helping, it's probably not going to help. It does help some people to take magnesium for cramping. Sometimes we know the reason why people cramp. So I actually had a patient today who came in with cramping. And so I'm going to check their magnesium level, make sure they're not too low. I'm going to check their Other electrolytes, so their potassium and their sodium, are also important to check. So if this isn't something you talk to your doctor about, I would. So we can check those. And then one of the things that can help with muscle cramping, especially nocturnal leg cramps, and something that is pretty easy to check is tonic water. The reason why tonic water can be helpful is because it has quinine in it. They actually had, they put quinine in all tonic water for a long time. They started taking it out, and people are taking it every night so they can sleep with leg cramps. And then they had no source of quinine. So people asked the company to start putting them back in, and they're now putting it back in. So if you go to the grocery store, you can see tonic water with quinine. Always something to try. It's not something that's gonna really hurt, and it might help that cramping. But like I said, if you're taking that level of magnesium and it's not really making a difference, I would talk to your doctor and see. For vitamin D, let's see if I put it down, in calcium. So for calcium, I would take at least 1,200 milligrams for women, and at least 1,000, 800 to 1,000 IU, which is international units of vitamin D. So a lot of times when you see a pill form, like if I just search calcium vitamin D supplements, they'll come together. Let's see. And so what we want to take is, so 600 milligrams is what I'm seeing mostly for calcium. So you're going to take 2 of those, and then the D3, vitamin D, you're going to want to take at least 800, if not a little bit more. And then I think the last question was, what is the best multivitamin to take? Really hard question to answer. And like I said, there really isn't a best one. It really depends on your diet. The best place to get these are from food. Our body metabolizes them better. Our body knows what to do with them better. And the way to know whether you're getting them enough from food is really a varied diet. So you want to eat the rainbow. You want to make sure, like I said, some of these vitamins are color specific. So your yellows and your oranges are really going to get you some vitamin A. Your blues are going to get you more vitamin E. So things like that. You just want to make sure that you're eating a varied, you're eating whole grains, you're eating healthy fats or healthy meats and things like that. It's really the best place to get it is a varied diet. If twist my arm to give you, I think those that are specifically for people who are elderly is usually what I recommend taking. So men's 1 a day, women's 1 a day, those things are fine. Centrum Silver, those things are great to take. Don't really have any problem with those. Again, not going to hurt you, might help you, might not.
Great, thank you. Next question I have for you is, for a patient who is vitamin D insufficient, but not to the deficit level, how much daily IU do you recommend in a supplement or supplementation at all?
Yep. So I think it can be helpful. It's probably not going to get you to taking too much. So I usually recommend about, again, same level as with the calcium and vitamin D. So 800 to 1,000. And then that is also something too that can be monitored. Again, it depends on your insurance. Medicare sometimes will not let me check it unless you are truly deficient. But so I recommend starting around 800 and then getting it rechecked if that's something that's possible.
Great, thank you. The next question, what supplements and vitamins are good for the liver?
Oh, so the best thing for the liver is going to be really avoiding things that hurt the liver. So the liver's job in our body is to get rid of all of these toxic chemicals that go through our bloodstream, and to store sugar, store protein, store a bunch of stuff. The best thing you can do for your liver is to not take stuff that's going to hurt your liver, which in our society is mostly going to be alcohol. So that is the best thing you can do for your liver. As far as like a specific vitamin and mineral that's going to really target, there's really not one that's going to detox your liver. I don't really trust anything that says it's going to detox anything, because that doesn't really have a good medical definition of what that even means. Our liver is the detoxifying organ, and it's pretty good at taking care of itself. It's an amazingly regenerative organ. So it's really, really not so much about what to take as what to avoid. So avoid those things that damage the liver, mostly alcohol.
Great, thank you. And next question, what are your thoughts on lutein for eye health care?
Ooh, let me look it up. So this is one thing I do all the time. So there are just so many dietary supplements. You go into the grocery store, or the drugstore, and there is a million things there. So I am as always willing to look stuff up for my patients when I don't know it, because there's just no possible way I can know it. I believe. Yeah, and unfortunately, a lot of my answers are going to be frustrating, because a lot of them are going to be, well, I don't know if they help you, but they probably won't hurt. So this is a vitamin A derivative, it looks like. It's a carotenoid, anti-inflammatory. Definitely can help you with eye health. It has been proven to help prevent age-related macular disease, so macular degeneration, which is this genetic component, if that's something you have. Definitely something that could be helpful. Let's see. Yeah, it's definitely, this is one of those things that I think is going to be, I would be more likely to take than something, and actually has some pretty good evidence that it is helpful. And I'm not seeing any glaring downsides. Let me keep looking, because vitamin A has issues. This is related to vitamin A. I don't see any. Yep, I'm not seeing any safety problems. All the studies that they have done have been shown to be safe. If you take very large doses, it might actually it might make your skin yellow and orange. But as long as you're taking it in the directions on the bottle, then it's almost certainly not going to hurt you, and there might be benefits. So this is one that I might actually try, especially if this is something that is especially if you have macular degeneration specifically, or any other eye problems. Definitely something to try.
Great, thank you. Next question is, how is magnesium helpful for calming as advertised?
Ooh, good question. I actually don't know the answer to that one. Let's see. So that is one of the things that's so difficult with these, is they don't have to, the standard of why these things help is not like with medications. If I'm making a drug, I have to have what's called a mechanism of action. So that is a very definitive, this is how it works in the body, or this is what it changes in the body and why it really helps. We don't really know, because there's still a lot of drugs out there like that. they don't have to do that with supplements. So there are sometimes a lot of hypothesized things that aren't necessarily true. Not saying that magnesium is one of those, just saying in general that makes this hard. So let's see. And of course, most of these haven't been studied. This is probably a problem with cost, just the benefit of spending billions of dollars studying magnesium supplement when you can't sell it. It's a deficiency. It's a problem with the system. So a lot of these just haven't been super well studied. Let's see. Yeah, there's no real mechanism about why this would help. Definitely nothing that has been proven, but it might have a role in kind of one of the things magnesium does is nerves, and the brain and our source of anxiety in our brain is part of the nervous system. So it can have some effects of modulating the neurotransmitters in the brain, which might help with anxiety. That's kind of what I'm seeing is the theory behind that. One of the difficulties is that's usually going to be helpful with people who actually have proven low magnesium levels, which most people don't. But there's no generally accepted mechanism of why it would help, and there's pretty mixed data that it does help.
Okay, great, thank you. And we do have a lot of questions, but we're just going to take one more. Dr. Phillips, would you be okay if we emailed you a list of the remaining questions and you answer them, and I can just send them to the attendees afterwards?
Absolutely.
Wonderful. So the last question we'll answer live tonight is, let's see, what is your opinion on taking a potassium supplement? Is it necessary?
So potassium is one of those things. So potassium, we didn't mention in this talk because it's technically not a mineral and it's technically not a vitamin. So what it is an electrolyte. So the electrolytes in our body are extremely important for nerve conduction, including conduction in the heart. I would recommend against taking a potassium supplement unless you have been told to by your doctor or with speaking with your doctor. The reason is because our body keeps potassium in a very narrow range, and too high is dangerous and too low is dangerous. So I would not take a potassium supplement unless you have been proven to have low potassium and you need it. Definitely one of the ones that can be dangerous, just to be a little hyperbolic, not potassium is what is given when people are having lethal injections. It's actually what stops the heart. Obviously, when you're taking it in an oral form, you're not going to be taking enough where that's going to be a problem, but you can cause it to raise a little bit and it can cause problems with your heart. So with the electricity going through your heart. So that is one I would actually avoid unless you have been told to by your doctor or with speaking with your doctor if they recommend it. One I would talk for an individual recommendation by your primary care doctor.
Great, thank you, Dr. Phillips. A friendly reminder, everyone, this webinar has been recorded and we will be sending out the recording through email by the end of the week. Thank you again to UCHealth for giving us the opportunity to learn about screens from Dr. Phillips. And thank you to all of those who attended tonight. We hope you have a great rest of your night.